Poor sleep alone doesn't kill you, but what you do in the first 30 seconds after waking up just might. There is one specific morning habit that most Americans over 60 perform without a second thought every single day. And new research suggests it increases the risk of a fatal cardiac event by up to 40%. Not smoking, not eating bacon, something you do before your feet even touch the floor. And the most dangerous part, your doctor has probably never mentioned it. Stay with me until the end, because the number one protective habit I'll reveal today is so simple, so completely free, that a major study published in the Journal of the American Medical Association found it reduced early morning cardiac events by up to 62% in adults over 60. And yet almost no one does it correctly, or at all. My name is Dr. Favor Adeyemi. I have spent over 20 years watching hearts fail, and I have spent just as long watching the same preventable morning sequence repeat itself in patients who felt completely fine the night before. Today, that stops with you. Before I name the habit, you need to understand what is happening inside your body the moment you begin to wake up. Because without this, the danger makes no sense. While you sleep, your body runs in a kind of low-power mode. Heart rate slows, blood pressure drops, your nervous system goes quiet. It is the only genuine rest your heart gets in a 24-hour period. But here is what most people never know. The moment your brain begins waking up, even before your eyes open, even before your alarm sounds, your body starts flooding your bloodstream with two stress hormones, cortisol and adrenaline. They begin rising roughly 60 minutes before you are fully conscious. By the time you reach over to silence that alarm, they are already surging. Those two hormones do three things to your heart almost simultaneously. Your heart rate jumps, your blood pressure rises, and your blood vessels constrict. All of it in a matter of seconds. When you were 35, your cardiovascular system handled that surge without breaking a sweat. The vessel walls were elastic. The system adapted instantly. But after 60, the picture is very different. The arteries are stiffer. The response is slower. And in many people who feel completely healthy, there is plaque silently built up inside those vessels. Plaque they do not know is there. When that hormonal wave hits a vessel wall carrying vulnerable plaque, the force can crack it. A cracked plaque triggers clotting. A clot in a coronary artery is a heart attack. A clot in a cerebral artery is a stroke. That is not a worst-case scenario. That is the mechanism. That is what I have seen on the operating table more times than I can count. This is why studies published in the American Heart Journal show that heart attacks are 40% more likely to occur between 6 and 10 in the morning than at any other time of day. It is not random, it is biology. And what you do in the 25 seconds after your alarm goes off either helps your heart manage that surge or tips it over the edge. I want to tell you about a patient I'll call Douglas. Douglas was 68, retired school principal. Careful man, the kind who took his blood pressure medication every morning without fail, walked for 30 minutes 5 days a week, and had his annual checkup like clockwork. His last cardiogram was clean. His doctor told him he was in good shape for his age. One Tuesday morning, Douglas woke up, silenced his alarm, and did what he had done every single morning for 15 years. He sat up fast, swung his legs off the bed, and stood up immediately. He took 3 steps toward the bathroom, and that was as far as he got. His wife found him on the floor. When I reviewed Douglas's case later, everything about his cardiovascular profile was consistent with a man managing his health responsibly. His medications were right, his diet was reasonable, his fitness was above average for his age. But no one had ever told him about the 25 seconds. We'll come back to Douglas. Because what the recovery room conversation revealed, the one change his cardiologist had never mentioned, is the reason I am making this video today. Here is the habit. The one specific thing that most people over 60 do every morning that silently loads the gun. They stand up immediately. That is it. Alarm goes off. They are vertical in under 3 seconds. It feels like nothing. It is completely ordinary. And for your heart at that precise moment in the morning, it is one of the most dangerous things you can do. Here is the science. When you are lying flat, your blood is distributed relatively evenly throughout your body. The moment you stand, gravity pulls a significant volume of blood downward, toward your legs and your abdomen. Your heart must respond instantly to maintain adequate blood pressure to the brain. In a younger person, that reflex is fast and precise. The vessels constrict, the heart rate adjusts, pressure is maintained in seconds. In adults over 60, that reflex slows down. The vessels do not respond as quickly. Blood pressure can drop 15, 20, sometimes 30 points within seconds of standing. Doctors call this orthostatic hypotension. You may know it as that gray, dizzy, foggy feeling when you first stand up in the morning. Many people over 60 experience it and assume it is normal. It is not normal. It is a warning. And here is where it connects directly to the morning hormonal surge we just discussed. When blood pressure drops suddenly after standing, the heart responds by compensating, spiking its rate and output aggressively to restore circulation. In a vulnerable heart, already under hormonal stress from the morning cortisol surge, already working against stiffer arteries and thicker blood, that compensatory spike can trigger an arrhythmia. It can crack a plaque. In the worst cases, it can send someone to my table. Standing up in under 3 seconds is the 25-second mistake, and it costs nothing to fix. There is a second reason the morning is uniquely dangerous, and this one surprises almost every patient I tell it to. After 7 or 8 hours of sleep, you are dehydrated. Every single morning, without exception. You have not had a drop of water all night. You have been breathing steadily for hours, which loses moisture continuously. The result is that by the time your alarm goes off, your blood is measurably thicker and more viscous than it was when you fell asleep. Think of your heart as a pump and your blood vessels as pipes. When the fluid moving through those pipes is thin and free-flowing, the pump works easily. When the fluid thickens, the pump has to work harder with every single beat. And thicker blood does not just increase the workload, it clots more easily. Research confirms that clotting factors are at their highest activity levels in the early morning hours. This is one of the primary reasons strokes and heart attacks cluster so heavily in that 6 to 10 in the morning window. It is the hormonal surge, combined with thick blood, combined with stiff vessels, all arriving at the same moment. A triple threat for any heart over 60. The fix is almost embarrassingly simple. A glass of water, room temperature, before anything else, before your coffee, before your medication, before you check your phone. 1 glass of water, taken before your feet touch the floor, begins thinning the blood, reducing clotting risk, and giving your cardiovascular system something to work with before the full demands of the day begin. This is the protective habit I mentioned at the start of this video, the one that JAMA research found reduced early morning cardiac events by up to 62% in adults over 60. 1 glass of water. Taken lying down or sitting before standing. That is it, and almost no one does it consistently. Quick question before we go further. Do you drink water first thing in the morning, before coffee, before anything else? Write yes or no in the comments right now. I read every single one. And the pattern I see in those answers tells me a great deal about what information is actually reaching people who need it most. Now let me give you the complete morning protocol, because once you understand the danger, the solution is straightforward. I call it the 90-second heart protocol. No equipment, no cost, nothing to buy. Just a sequence that takes 90 seconds and protects your heart every single morning. Step 1. The moment your alarm goes off, do not move. Stay exactly where you are. Take 3 slow, deep breaths before you do anything else. In through the nose, out through the mouth, fully and deliberately. This single action activates the parasympathetic nervous system, the calming branch, and begins to counteract the cortisol surge before it peaks. 3 breaths, 15 seconds. One of the most powerful cardiovascular protective tools that exists, and it is completely free. This is your 25-second intervention. Not dramatic, not complicated. But the research on slow, deliberate breathing immediately upon waking shows measurable reductions in morning blood pressure spikes in adults over 60. Step 2. Drink the water before you stand. Keep a full glass of water on your nightstand tonight. Before your feet touch the floor, drink it. Room temperature, the whole glass. This is non-negotiable. You now understand why. Thin the blood. Reduce the clotting risk. Give the pump better fluid to work with before the day begins. Step 3. Sit before you stand. Roll to your side. Push yourself up slowly. Sit on the edge of the bed with your feet hanging. Do not rush. Rotate your ankles in slow circles, 5 times in each direction. This activates the muscle pump in your calves, which pushes pooled blood back up toward the heart and helps restore blood pressure gradually. Sit for a full 30 seconds before you stand. Then rise slowly, pressing through your legs. Stand still for 10 seconds before you take your first step. That is the complete protocol. 3 breaths, 1 glass of water, sit before you stand. 90 seconds total, starting tomorrow morning. If you are currently taking a diuretic, a water pill for blood pressure, there is one additional thing I need you to know. Diuretics work by flushing excess fluid from the body through the kidneys. They are effective and widely prescribed. But when the kidneys flush fluid, they also flush magnesium. And magnesium regulates the electrical signals that control your heartbeat. When magnesium levels drop quietly, which they do in a significant number of people on long-term diuretics, the heart becomes electrically unstable. Palpitations, erratic rhythm, arrhythmia. And it tends to surface hardest in the morning, precisely when the heart is already under the greatest stress. If you are on a diuretic, ask your doctor at your next appointment to check your magnesium level. A 2-minute blood test. That information could be genuinely important for your heart. I promised I would come back to Douglas. In the recovery room, after he had stabilized, I sat with him and his wife, and we talked about his morning. He described it exactly as I expected. Alarm, immediate movement, straight to vertical, straight to the bathroom. Every morning for 15 years. Nobody had ever questioned it. His previous cardiologist had reviewed his medications, his diet, his exercise. Nobody had ever asked about the 25 seconds. We made one change before he went home, a glass of water on the nightstand. The 3-breath rule. Sitting on the edge of the bed before standing. 6 months later, he came back for his follow-up. His morning blood pressure readings, which his wife had been tracking at home, had stabilized significantly. The dizziness he had always dismissed as normal was gone. His cardiologist had noted the improvement and asked what had changed. Douglas told him, "I stopped standing up fast." "Why didn't anyone tell me this sooner?" He asked me that in the corridor. I didn't have a satisfying answer. But I told him what I'll tell you now. The information exists, the research exists, and the habit itself costs nothing and takes 90 seconds. It simply needs to reach the people who need it before the morning it matters most. You are that person, and you now have it. Let's bring this all together. The morning is the most dangerous window of the day for your heart after 60. Cortisol and adrenaline surge before you are fully awake, driving up heart rate, blood pressure, and vessel constriction simultaneously. Your blood is at its thickest. Your arteries are at their stiffest. And the habit of standing up immediately, something 90% of people do without thinking, adds a sudden pressure drop that forces an already stressed heart to compensate aggressively. The fix is 3 steps. 3 breaths before you move. 1 glass of water before you stand. Sit on the edge of the bed for 30 seconds before rising slowly. That is your 90-second heart protocol, starting tomorrow morning. Here is what I am asking you to do today. Put a glass of water on your nightstand tonight. Just that one thing. The rest will follow. Which part of this surprised you most? Tell me in the comments. I read every one. And if this gave you something you needed, share it. There is someone in your life who wakes up every morning doing exactly what Douglas did. You may not know who it is yet, but this video might be the thing that finds them before the morning it matters. If you haven't subscribed yet, please do. Every week I bring you honest, research-grounded information about what your body needs after 60. The information I wish every patient had before they ever ended up in front of me. Take care of your heart. It has been working for you every single minute of every single day without asking for anything in return. Give it 90 good seconds tomorrow morning. It is more than a fair trade. Disclaimer: everything shared in this video is general medical information based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, exercise habits, or morning routine, please speak with your own physician first. They know your history. Bring this information to that conversation. That is exactly where good medicine begins.